Dr. Caldwell, thanks a lot for being here. Again, 2 years in a row, and I know everybody was excited to hear you again this year because of how well received it was last year. So first, thank you. It means a lot that you came out for this.
I'm very happy to be here. Thank you.
We consider the Meadows a real great partner, and you've recently changed roles there. Do you mind just filling everybody in on that?
Yeah. So I'm now Chief of Psychiatry, and it allows me to continue doing clinical work, which I love, and now to branch off into doing some speaking like this and business development, program development. I've brought my workshop into the Meadows, so we're doing it on the weekend for our inpatient population, and we've turned it into a 5-day workshop to be alongside survivors and grief workshop and some other workshops. So
it's really neat.
Yeah.
Congrats.
Thank you.
You mentioned today in your presentation that last year, and it was an impactful weekend for all of us, I think.
Yeah.
It influenced some of the work you've done over the past year. Can you elaborate on that a little?
Yeah. So I really came into the trauma field working primarily with women. And I've spent a lot of time working with women and trying to understand childhood maltreatment. Some of my research has been devoted to women. And so then I was invited to this conference and started hearing people talk about men. And something really got stirred up in me, both personally and professionally. And I realized that I wanted to do more work with men, and I wanted to understand my own work more through the framework of a man's work and masculinity, gender roles. And so I've been studying for the last year, really, trying to understand it more. And I've been doing some research. So I started a study looking at the relationships between childhood maltreatment, attachment, shame, and self-compassion. And some of that came out of the work that Brene Brown has done in her talk last year. And she talks about self-compassion being an antidote to shame. And I really wanted to see, if I could do some research to pin that down and understand what that looks like more. And it really fits in with my broader interest in mindfulness and self-compassion. And it's been a great year for me. I mean, it's been a lot of fun to push myself to think more about men and more about gender, and to do some more research.
You shared a Rumi poem early on in your presentation, and to me, the word that just kept jumping out there in that was integration, the kind of acceptance of self and the integration of all of who we are.
Yep.
I think for folks early in recovery who might have a chance to hear you now, can you talk real briefly to this idea of integration and the importance of that concept and acceptance?
Yeah. I love the word integration. Well, when I first got into recovery myself, what I realized was that I had been running from myself for a long time. I remember being in my backyard and with my wife and children, and I started feeling something that was really familiar and uncomfortable. And I didn't know what it was. I just knew I wanted to do anything to get away from it. And in that moment, I would have if I hadn't made a commitment to recovery. And so I tried to stay with it. And I realized in that moment, I've been running from this feeling for my entire life. And the feeling was really something about, I'm not okay. I don't measure up. Something's wrong. It shouldn't be like this. Something like that. And I came to understand that as shame. And what I had been doing was sort of projecting who I wanted people to see and hiding a whole bunch of parts of myself that I was ashamed of. And that sort of chasm between who people thought I was because of what I was showing them and who I really was inside, or who I thought I was inside, grew to a place where I was just desperate. And I was throwing all sorts of stuff into that chasm. you know, like anything I could get my hands on to make myself feel better and to feel more whole. And it was just like, it was like an empty, bottomless pit. It just took everything from me, and it threatened, you know, the things I loved most in my life, the people I love, and the work I like to do. And finally, there was a point where it was like, all right, I'm going to try and see what is here, what's really here. I'm going to try and pay attention to what I'm really feeling. I'm going to start honoring those other parts of myself that I've shut off, that I've compartmentalized, that I've swept under the rug, that I've said shouldn't be here, or are not important, or are disgraceful or shameful. And that really started a process of this sort of radical acceptance, you know, really trying to befriend, what I call befriend my true nature, to really sort of dig deep and figure out who I am, and then sort of befriend that. Say, can I be friends with what I find here? And it's not always easy. You know what I mean? I still run into parts of myself. I mean, last week I reacted to my son in a way that was harsh. And, you know, it was like, it was hard to see that part of myself. And it was hard to say I'm sorry. It was hard to admit it to my wife. You know, I'm a work in progress. There's a lot of times where I'm still actively utilizing these tools. And that's humbling. But at the same time, something I started to learn early on in recovery is like, it's really not a destination. It's going to be you know, it's going to be a progress, a pathway. It's going to be something I'm going to be doing my whole life. And then there came this thought of, if I had to do this for the rest of my life, it's not such a bad life.
Right.
You know, if I had to be honest, if I had to be in touch with my feelings, and if I had to try and have integrity, you know, what's so wrong with a life like that? And so now I try and just welcome, this is the life. This is the life I have, and it's a good life, you know.
Sounds much more authentic than just trying to slam the door on the past.
Yep.
I think the visual I've had over the last 4 or 5 years of real intentional work, in addition to my 12-step program, has been this monster that I've tried to keep locked in there, and I got every kind of padlock imaginable on that door.
Yeah.
I've been trying to open it up and shake hands with them a little bit. It's okay that that's there, and I want to integrate that with who I am and be a better man than that, but not ignore that.
Yep, I think that's key. The Buddha, he had these disciples, and they were very afraid to go into the forest because they were afraid of evil spirits. And so he had a saying, he said, invite them for tea. So, you know, this is along the very same lines. This pathway that you're talking about, that you're doing, has been done for 3,000 years, which is a pathway that has been done in various traditions, various religions. It's not a religious thing, it's a spiritual thing. It's about really bringing a sense of presence to ourselves and trying to show up for our life, you know. So it's great.
That message of acceptance is to me, the antithesis of the toxic shame that you describe.
Yeah.
But your presentation on toxic shame, how do you see shame as a barrier to recovery, not to treatment, not to recovery? How does shame get in the way of someone finding wholeness?
Yeah. Well, at its core, toxic shame is really about, you know, something is wrong with me. I'm defective, you know. And I think to really have a true recovery program, not just sobriety, but a recovery program, it involves, you know, that process of really healing that old wound that, you know, we picked up somewhere along the way that says something's wrong. We're not good enough. We're never going to measure up. We can't hang with these people over here. And to get in touch with this sense of inherent worth, that there is, I don't have to prove it. I don't have to do something, show something, that the person I am and the deepest part of who I am is okay. And that brings a level of recovery that is profound. What I tell people is, if you've gone to those places, if you've looked the monster in the eye, it's pretty hard for somebody to say something or do something to trigger you, to make you want to go out and use or do something. If you've gone there yourself, then, you know, you're able to say, okay, yeah, I've looked that one in the face. I know what it's like to lose somebody or something I hold dear. I know what it's like to have somebody say something about me that doesn't feel very good. I know what it's like to look at my weaknesses and my shortcomings, because I've gone there myself. And then there's a sort of a freedom that can come from that, you know? Because it's like, the world isn't going to throw me something that I can't find a way to deal with, because I know how to go in and sit with myself and be with myself and work through that. And that's empowering.
That's fantastic advice. Yeah. Last thing, when you, almost last thing, when you describe self-compassion as almost an antidote to toxic shame, can you, especially for those folks who may be really early on, really practical, can you give us one or two things that we can do to substitute self-compassion with shame?
Yeah, great question.
Or reverse that, maybe.
Because it really, the people who do this kind of work realize that it has to translate into action, and that it can be hard to do that. People find it very difficult to offer kindness, gentleness, and compassion to themselves. One thing I like to do is, when we see something that could be seen as being negative, to try our best to not have a lot of judgment about it. And one way to do that, this term in meditation or in Buddhism is called equanimity, to approach our experience without a lot of judgment, without a lot of preconceptions, to just say, okay, here it is. So I'll give you an example. I was walking from the parking lot into work about 6 months ago, and I was going to give a talk soon, and I just got gripped with this adrenaline feeling in my body, and the feeling was, oh, I have this talk I have to give, I'm worried, what if it doesn't go off okay, that kind of thing. And sometimes I would either push that experience away, like, oh, I can't deal with that right now, or sort of get caught up in the middle, like, oh yeah, this is bad, I got to prepare more, I got to do 2 more hours tonight, you know, I got to fix this, I got to take, you know, this planning, all this mental stuff that we do. Luckily, there was a moment there where I just was like, oh, interesting, self-doubt. So I just applied a quick label to it, self-doubt. Doesn't have to mean anything more than that. Doesn't have to like go into the next phase of I gotta fix it or change it or do something different, or why is this here, or gosh, I can't believe I'm still having self-doubt. All of that adds on another layer of suffering. So I can just say, oh, I'm noticing self-doubt. Interesting. Okay. So self-doubt is here. It came up again later that day. So that gripped feeling of something's wrong, do more, and it was like, oh, self-doubt. And then at the end of the day, came back again, self-doubt. By that night, it was pretty much gone. I was feeling differently about it. So that's a mindfulness practice that opens the door to having more self-compassion, because we recognize this stuff is pretty transient. It comes and it goes, you know. The emotional landscape is sort of always changing. If we can just stay with it without reacting to it too much, oftentimes we can come out on the other side and feel a lot different. The other thing I like to do is tell people that many times the reaction that they're having, the reactivity they're experiencing, whether it's fear, anger, jealousy, pain, hurt, oftentimes if they can stay with that reactivity a little bit, what they learn is that it's being fueled by some old story of what's happened to us before. And if we can get in touch with that connection to the past, it allows us to say, okay, so my reactivity, my anger may have served a purpose in the past. It may have helped me to feel strong, to feel tough, to feel I can like tell people to back off and keep my space. And it served me well when I didn't know other ways to deal with this. And now there's maybe another way through this. There's another way to respond with less anger. So by recognizing our patterns as being survival mechanisms from the past, you know, depression sometimes is a way to shut down.
Mm-hmm.
Fear is a way to think about things a lot so we can find an answer to it. These are old patterns that can stay with us for a long time. And if we see them as ways that we have survived difficult experiences, then we don't have to be so harsh about it. It's like, there you are, my old friend, anger. There you are, my old friend, fear. I know why you're there. I understand where you come from. And I want to try a different path forward. So it helps us to have compassion for that part of ourselves that's wounded or reactive or angry, and recognize that there's other ways to deal with it. And almost like, we're almost sort of like invited in, like, it's almost as if I sometimes tell people, you know, we have these really wild storms in Arizona that are monsoons, you know. And if you're as wide and as vast as the sky, then you can tolerate the storm clouds moving through, you know? So if you can back up from your experience and sort of occupy that wise place of, I'm bigger than this moment, I'm bigger than this anger, I'm bigger than this pain and this hurt. There's some part of me that is unconditionally lovable, that is decent and good, that I'm like the sky, and I can tolerate the stormy clouds that move through. And I can monitor that and watch that and notice that without having to be sort of, you know, rattled by it.
I had someone tell me once in a meeting that those old emotions, the anger, the frustration, the hate, the guilt, that's a suit that we had to wear a lot. And we've had it hanging in our closet and still there. Maybe it's just a little out of style.
Yeah, that's great. I love it.
Well, in addition to being a fantastic presentation that we really appreciate again, that was probably the most singular, it was the most beautiful PowerPoint I've ever seen in my life. So our hats off to you for your PowerPoint skills as well, and your technological prowess.
Thank you.
So Dr. Caldwell, thanks a lot for being here. We appreciate it.
You're welcome. My pleasure.